A very good morning to my lecturer and my fellow friends. I'm Haridas and today I'm here with my teammates to present the topic regarding confidentiality. I'm sure all of you will be wondering what is confidentiality. Confidentiality is where a physician or other health professionals hold secret of all information relating to a patient. For example, is the patient's name, address, social security number, diagnosis, and illness should all be kept confidentially. Why is this confidentiality very important? Because if this confidentiality of the patient is not protected, trust in the physician-patient relationship would be hard to maintain, and maintaining confidentiality will ensure quality care by showing that your patients can count on you for maintaining privacy and respect for their care and their medical records. Confidentiality issues are also a standard of practice related to ethical and professional healthcare. So next, I'll be talking about a case study which is related to my subtopic. Ivy, a 34-year-old woman who recently returned from overseas and is 3.5 months pregnant. She also has a 7-year-old son and she was diagnosed with HIV in February 2016. Ivy has no income and she is living with her friends, and she has been practicing safe sex and tested regularly. However, she had one incident where the condom broke and she feels there is no need for her to take medicines because her doctor said he couldn't tell her if there will be any long lasting side effects to her unborn child. Ultimately, Ivy decides not to take medicines during her pregnancy at the time of delivery. Ivy's baby tested negative at birth, and however, Ivy hasn't contacted her counselor for few days, so it is unsure what is she facing right now. During the last call, she was afraid to share her private information and was worried about her confidentiality. Now, there are many appropriate ways the counselor could have done. The counselor could have called Ivy and asked her consent if she is comfortable communicating through the telephone. Second is the counselor must make sure that no one is beside her to avoid any unauthorized person from listening the conversation. The third is the counselor can inform her that the information that she is sharing will be kept safely. The fourth is the counselor can tell the pros of cons of communicating through the telephone. That's all. Thank you. Among the three ethical issues, today I'll be presenting on the privacy issues with telecommunication device. There are many ways a therapist can secure the client's information. First is therapy should properly secure digital records of the client by using passwords, firewalls, data encryption, and authentication to protect the client's privacy. By doing this way, the therapist can avoid any unauthorized person or any hackers from entering and getting the client's information. The third is if the therapist is interested in communicating through email and text, clients should be informed about this method. By doing this way, the therapist can know if the client is comfortable or not communicating this way. A therapist should also verify he or she is talking to the client and not to any unauthorized person. Therapist should not make any comments that their client don't want to hear and avoid saying anything off the record. The therapist should also be aware of talking to something confidentiality over the telephone and always assume that the client is not in the private place. This is to avoid any unauthorized person from overhearing the conversation. The therapist should also verify that he or she is talking to the client and not to an unauthorized person, and make sure there is no one beside the therapist and the client when communicating through phone, email, or text. This is to avoid any leakage of the client's information. One of the ways the therapist can do if he or she wants to communicate with the client through phone, text, or email is by modifying the informed consent. Therapy should incorporate a method of securing, protecting, and handling data. Therapy should also include present occurrent risk of data storage and communication. It may be appropriate to suggest pen and paper if it worries about the concern are present. Second is therapists can also use the two-factor authentication. The two-factor authentication requires a person to enter a password and 6 to 8 digit token. Mobile devices can be often used to receive two-factor authentication through text message. The third is by using the HIPAA compliant cloud providers. Therapy should publicly document its privacy policies. Google Apps uses various standardized security certificates to ensure data safety.
Hey guys, good morning. It's Dinesh here. So today I will present about the disclosure of a client's HIV status. HIV status or HIV disclosure is the personal experience of communicating to another individual or group of individuals that you are living with HIV. Based on the case study above, during the last call, Ivy was afraid to share her private information to the therapist and was worried about the confidentiality. In order to overcome this issue, the therapist may explain the types of disclosure to Ivy. There are certain types of disclosure we can find from this. Uh, First one is voluntary disclosure. It refers to when a client shares the information about their HIV status to other people. This may be partial or full disclosure. A counselor should help the client identify the problems, the impact on their decision. Full disclosure is when the client publicly reveals their HIV status to a person or organization, for example, a family member, media, friends, and etc. Before a client disclose their HIV status, a counselor can assist them to explore who to tell, how to tell, when to tell, and this way the clients may in control of what they want to say and how to say it. Third, partial disclosure. It means that the client will only tell a certain people about their HIV status. For example, wife, husband, relative, counselor, or friend. Counselors need to assist their clients to think carefully and prepare them for a range of possible outcomes before disclosing this status. The client may not be able to control what happens once they have disclosed. Most of the cases of voluntary disclosure arise from the situation where a client decided to partially disclose their status and without their knowledge of information is made publicly by an individual or organization. Fourth, a non-disclosure. It means that a client doesn't need to reveal their HIV status to anyone anymore. In voluntary disclosure, it happens when someone reveals someone's HIV status without their approval or even without their knowledge. Lastly, shared confidentiality. This disclosure is usually on understanding that people will not tell others unless they have to give any permission to do so. If a client wants to disclose their HIV status but they are unsure about the possible consequences or outcomes, the therapist can assist them by informing them the potential consequences of disclosing and non-disclosing the client's HIV status. Possible consequences of disclosure. Due to the stigma attached to the HIV, the disclosure of HIV status can sometimes lead to negative consequences, especially in short terms. Possible consequences include the clients may experience problems in relationship with their sexual partners. They also might experience rejection from their family members, friends, work colleagues. Usually, a client who discloses their HIV status may feel that people are constantly judging them and abuse them based on their HIV status. Moving on to the next slide. The possible consequences of non-disclosure of a client status. Sometimes it seems there's too much of to lose by disclosing her HIV status, but non-disclosure can also have a major consequences. The clients may experience from a lack of support from family members and friends, forcing them to deal with everything by their own. Besides that, they might put others, particularly their sexual partners, at the risk of infection. If the client is not disclosed about the situation, they may unable to obtain necessary medical care or counseling or support from others. There are possible reasons why a therapist needs to disclose the client's HIV status. Client's HIV disclosure can help a client to accept their status, and it reduces the stress which they are coping up on their own. Disclosure can help the client to access medical services and support that they need. Disclosure also can help the client and others while having a sexual relationship. Disclosure also promotes responsibility, which a client can help to decide on their future plans. Law relating to the disclosure of a client's HIV status. In this case, the law is not clear on the duty to protect in this case involving HIV status. From a legal standpoint, breaching a confidentiality of a client HIV status is not one of the expansion to the confidentiality. That's all from me. Thank you for listening throughout this presentation.
Hi, madam. I am Arvind, son of Sangaran, and I'll be talking about the recommendations for counseling on HIV positive clients. Counseling is the first step in the uptake of HIV or AIDS-related healthcare services. According to the United Nations Population Fund in 2005, counseling is a dialogue between a client and a counselor which aims at enabling the client to cope with stress and take personal decisions related to HIV or AIDS. This may be achieved by self-introduction, in which handshake and ensuring sitting arrangements must be such to minimize obstacles and encourage eye contact in a non-confrontational posture. The counselor should speak in a non-threatening tone or manner. It is also important to emphasize that the counselor should be able to empathize with the client. In interviewing clients, skills must be applied to use open-ended questions and not one-word response. Questions asked to the clients should be ranked, and if clients have several concerns, they should be also ranked. Avoid the usage of technical terms, and if certain jargon terms are used by the clients, they should be clarified. It is also important for the counselor to be able to evaluate the emotional state and explore the feelings of clients such as worries, anxieties, mood, fears, suicidal ideas, hope for future, and etc. The counselor should allow ventilation of various feelings such as fear, anger, despair, and etc. It is also important that the counselor should be honest in providing all information while giving support and must avoid giving false reassurance to the clients while, on the other hand, giving hope to them. There are several examples of one-on-one counseling methods used for risk reduction counseling among HIV-positive individuals. The various dimensions touched upon were use of a negative approach, assessing readiness to change, and motivational enhancement therapy. Hence, we see multiple approaches used by counselors in providing education and prevention counseling to at-risk individuals and also individuals who have been infected with the virus. Internet-based counseling has gained some popularity over recent years but has to deal with issues such as lack of visual and verbal cues, confidentiality, accessibility problems by those in great need and increased client separation. Counseling related to using spiritual coping techniques have been well established in cancer literature, but has limited evidence in HIV-related counseling. It is mainly applicable as a psychosocial adaptation technique. Post-test counseling in positive cases is done after confirmation by a supplementary test and should be done without delay. During the counseling process, time should be given for the client to understand the meaning of the results, allow ventilation of feelings such as silence, anger, fearfulness, hopeless, and etc. Emphasis should be given on the difference between HIV infection and AIDS. The counselor should further explore and acknowledge the various psychological reactions and concerns of the clients. Time should be given for the clients to clarify concerns and worries about the test. Counseling processes should emphasize modification of risk behaviors and lifestyles to prevent further spread of the virus. Follow-up should be given in all cases of positive results. If the result is positive, it is important to discuss the following. If the result is positive, it is important to discuss the following. Firstly, patient's understanding of the test results, coping with the positive result and needed psychological or emotional support, prevention of HIV transmission to others, further medical follow-up, appropriate referrals to medical, social, and spiritual support services as well as peer groups and partner notification. Moving on to things to avoid when counseling. First of all, do not make unrealistic promises or lie to a patient for any reason. Do not postpone counseling after an indeterminate result. Be sure to identify sources of support for a patient waiting for test result. Do not smother the patient with care or probe unnecessarily about his or her personal life. Do not give advice when the patient does not ask for it. If you would like to offer unsolicited advice, ask the patient if he or she would like to hear your ideas. Do not express excessive sympathy or denunciation. Remember that the main objective of the provider is to provide support to the patient, but not to impose his or her emotions. The recommendations that have been told are not only for the case study, but also for all HIV-positive clients. Now, regarding the case study, the counselor must make sure IV knows that HIV-positive mothers should not be breastfeeding. In order for IV's child to be safe, she must take note that HIV-positive children may have been infected through blood transfusion or mother-to-child. In these cases, the counselor has to deal with feelings of guilt, depression, sad, anger, and etc. The counselor has to deal with these children as they grow up. In some cases, however, clients allow health workers to disclose their status to selected persons in the context of shared confidentiality or couple counseling. Yet, some clients accused some health workers of a breach of the concordat during counseling. When breaching confidentiality, it is important for mental health professionals to take reasonable precautions, seek consultation and supervision, refer to and review state laws and professional ethical guidelines. Next up, there is a short clip for counseling in special cases which is regarding the case study. That's all from me. Thank you.